Welcome to the Ask Faleskini Podcast with a guest. I'm proud to present Dr. Q. Dr. Q, welcome to the show. Please tell us more about yourself. What is your story?
Yes, hi. Thanks for having me on. So I'm Dr. Furhan Qureshi. My patients and peers call me Dr. Q. Yeah, I'm a board certified internal medicine physician. I've been in practice for a long time now, I guess. It feels like yesterday, but I think it's been about 15 years now. I have my own practice in Northern Virginia in Sterling. We are a neuro-aesthetic and wellness center. We are a specialty practice. We do aesthetic medicine as well as longevity and anti-aging medicine. Um, let's see. I also work a lot in the hospital as a hospitalist. I do inpatient medicine. I also sometimes work, in the ICU. I'm also a reservist for the United States Air Force, and I guess I'm also an amateur karaoke specialist. I enjoy karaoke as well. Like to put that in there as well. But yeah, those are just some of the things that I do.
Amazing. I really like what I hear, and I have so many questions for you. So,
Sure.
um, you said that you have your own practice and that you specialize in aesthetic medicine and longevity.
Yeah.
Can we talk a bit more about longevity? What is realistic right now? Because some say that we can live 300 years, some say 120, and there are these different um, let's say definitions of longevity. What can an average American expect? How many years they have?
Well, I mean, the real question is what is the definition of living? There are a lot of people who are alive, but they're not living, in my opinion. But yeah, it's a great question. I think from a scientific standpoint, we've been we've been successfully, able to push the boundary for a long time. I think the focus in longevity and anti-aging medicine, it's not necessarily to make people live longer physically, although that's always a goal. The goal is to make them live better. Is more in the field of optimization. What we're all learning now is that patients are fully aware that they can live a long time. They're not looking for just the length of life. They want quality. They want strong quality. It's a more proactive area of medicine. It's a more novel kind of concept. These are people who are proactive. These are people who tend to take their health very seriously. They don't come to the doctor when something is wrong, like most patients. It's the other way around. They come to us wanting to run faster. They come to us wanting to have less pain. They want more energy. These are people who want to push the body's limits and have a higher quality life and are looking for more novel, cutting edge treatments or procedures that can help them achieve that.
I would like to know a little bit more, and I would like to know your opinion on many topics that are now circulating the internet. And
Sure.
one is stem cells. What do you think about stem cells as a longevity hack?
Yeah, that's a good question. Stem cells are not new. This has been something we've been trying to do for a long time. Um, the theory of stem cells is such that you're taking these premature cells and you can reprogram them to a cell that your body needs, and you can regenerate. You can have uh, a new outcome. So the theory was if you, for example, needed a kidney transplant, maybe one day, we can regenerate your kidney cells and you can have your kidneys back. Um, there's still a lot to be done. I was hoping we would have more progress by now. We don't. But there's one area of regenerative medicine, especially stem cells, that's very exciting, and that's in orthopedics.
Mhm.
Um, we're getting better. We're getting better at not necessarily, using premature stem cells and specializing it, but we're getting better at using other kind of uh, other parts of the soup, so to speak. Different other like enzymes, exosomes, different parts of the of human tissue, of fetal tissue. And in the world of orthopedics, there's emerging evidence that there may be benefit there. I know, for example, Blue Cross Blue Shield, they are starting to cover, for example, if you're injecting, certain type of stem cells or exosomes in knee joints, they're starting to reimburse for that because people are starting to get, arthritic relief. So there is emerging evidence there. Um, I think right now, as far as regenerative medicine goes, the most promising areas seem to be in the world of orthopedics and arthritis, but some of the more sensational, diagnoses like curing MS or like curing, some kind of, ALS. No, there's just nothing there that I have seen. But most of the promise has been in arthritic and musculoskeletal areas. And also there's been some evidence emerging about, for aesthetic uses, like topically, people are getting, better skin using human exosomes, and there is some hair regrowth, but um, it's still early and the data is still limited.
Okay. What's your take on the supplements?
Well, I think supplements are great. I think supplements are they're what they say they are. They're the supplements. They're extra. They don't replace fundamentals. Um, I think Americans right now, it's a wellness is a multi-billion dollar market right now. There's a tremendous interest in things like peptide therapy and wearables. There's always ads on Instagram about a new kind of wrist strap that can measure, your blood pressure and all these things. There's an obsession right now with wellness and trying to, push you to the limit. Um, I am pro supplements, especially certain supplements that have very good data, like creatine. Creatine is really good. There is some emerging evidence there that not only is it good for muscle strength, because that's what we usually use it more for. I used to use it more for, just strictly for weightlifting, but there's data that no, you take it every day, at least 5 grams. It can help with cognition and memory. So there's emerging evidence there for that. Um, vitamin D, I think almost all Americans will need that. We're working indoors. We don't have as much sunlight exposure, so we're not getting much activated vitamin D. But I do want to make clear that, you know, supplements, some may be more effective than others, but they're extra credit. They won't replace fundamentals. Fundamentals are going to include diet and exercise. And good sleep. Those are fundamentals. Those with poor sleep, high processed diets and little to no physical activity. I don't think there's a supplement that can cancel the damage that's about to happen.
Mhm. And I would like to have your take on vaccination because there's a huge fight in America right now going between
Yeah.
pro-vaxxers and anti-vaxxers. What's your take? What is your experience in this?
I think I think what's happened is I've spoken to a lot of people who are anti-vaxxers, and it's not that they all hate all vaccines. That's not what they tell me. What they tell me is, look, like almost all anti-vaxxers will tell me that I do see there's a role for vaccination. My only complaint is why do we need so many? This is what they say. And it's a fair criticism. Um, because I think what they're looking for is reassurance that we must have all these vaccines. Why can't we just do it the natural way? Well, these are fair points. I think what we ought to do is we're gonna have to educate people more about the vaccines and what they do because most people have this impression that a vaccine, like what is it, what even is a vaccine? A vaccine is basically, you're giving a small piece of the disease, like in a weakened state, to provoke your body to make a immune reaction to it, and thus generate these antibodies that will have memory. You'll have an immune memory so that when you get the actual um, pathogen in you, the actual disease-causing pathogen, you'll be ready. You'll be able to generate a stronger immune response. For things like measles, it's highly effective. Like well, once you're vaccinated once, you don't need it again. But the problem is that certain viral pathogens like the COVID virus, unfortunately, every time we make a vaccine, a bad and for flu, we have to make a new one almost every year, like a lot. And the reason we're doing that is because those particular viruses mutate a lot. They don't retain the same structure. So what happens now is you have to make new vaccines for it. So now people get frustrated. Why can't I just take it once and done, like the measles, mumps, the MMR vaccine? Well, because those viruses are different. I mean, those particular viruses keep the same shape and they're consistent. These other ones are highly mutatable, so we have to keep doing it. So I guess the question is, do you have to do it? You know, um, what I explain to people is that, look, I cannot guarantee you that if you get a flu shot, you're not going to get the flu. Heck, you might get the flu a month later. But there are studies on this. There are studies that show that those people who were vaccinated, they had this much decreased mortality and this many days off of work less than those who didn't. So from a performance standpoint, it is encouraging. We are a free country, people ought to have the choice of what they want to do. Um, but um, I would recommend. I personally, will get the vaccines. The COVID one, I kind of I kind of soured on the COVID vaccine in particular because it's just too many vaccines. You can't keep getting poked every few months or every year. But I do kind of we'll follow the CDC guidance on what they think we ought to have. I think especially certain populations like diabetics and those who are immune compromised, they still have to get the new vaccine of that. But I know that uh, the CDC doesn't necessarily enforce or want us require the COVID vaccination. Flu is still recommended, and again, that's not because you're never going to get sick. It's because there's data that shows you'll be off of work. You'll take less days off of work when you do get sick, and you have improved outcomes, morbidity and mortality wise.
Thank you. Um, you're also into the aesthetic medicine. Can we
Yeah.
talk a bit more about that?
Yeah, sure. So, it's becoming quite popular. People are all out there, getting something done. Your doctor here personally gets stuff done. I usually get my own face lasered every few months because I just love the way my skin looks afterwards. Um, uh, we're in a very we're in a world that is very where your appearance is judged very frequently.
Mhm.
When you apply for a job now, you see in the old days when we used to, when I'm a 90s kid, when you used to apply for a job, you would fill out an application and anonymously put it into a slot. That's not true anymore. Now you're on LinkedIn. What does LinkedIn have? It has your face on it. Your appearance is an increasingly essential part of your life now. When you're going on a date, there was a time a long time ago where people would anonymously, fall in love just from writing, letters to each other without showing or just showing one picture. Not anymore. Now people are going on dating apps and the most all the dating apps will tell you the most important part of the profile is your picture. They all, like eHarmony and all those different companies, they put in their instructions, look, do the best you can, but the most important part of your profile is the picture. So choose good pictures. So they all will tell you the 70% of their of your profile is your appearance, your pictures, how to take it with good lighting, um, dress well, smile. So it's a large part now of our society more than it has ever been before. Um, now that people have now that our science and our technology has evolved as well, there's a growing a field of non-invasive aesthetics. Not everyone, can afford to get a facelift or even wants to get one. But maybe you don't have to do a facelift. Maybe you can do, some more affordable lasers. Maybe you can do all, radio frequency microneedling. You can do other things that can improve the aesthetic appearance of yourself and thus boost your confidence, maybe boost you in your professional and your private life. So yeah, it's growing. People are investing in it and the outcomes are, they're obviously pretty good.
Amazing. Thank you for this input. I especially like the non-invasive
Yeah.
ethics. And Dr. Hugh, before we wrap up, where can our listeners get in touch with you? Where can they see what you're working on?
Yeah, for sure. So our website's a good starting point. It's www.thenormd.com. So it's the Nor Noor MD.com. You can start there. We're also on YouTube and we're on social media. Yeah, we're also on Instagram, so you can find us over there as well. You can go to at the Noor MD clinic, and see our social media, see what kind of stuff we have there. I think my personal account is on there as well, so you can see me in all my travels. And yeah, see all our stuff, and sometimes I show up on the news as well. So there's different places to find me.
Dr. Q, thank you for all these insights and thank you for being my guest tonight.
Thank you for having me. It's an honor and pleasure to be here.